are not designed to meet the required standards for disability access. The current economic development for Vietnam does, however, provide the opportunity for change within the infrastructure and to meet building standards as stated within the disability legislation. With careful planning, this may in time reinforce disability inclusiveness within the wider community. As buildings become more accessible, the visibility of independent people living with a disability may provide the opportunity for greater acceptance within the community of people with disability as citizens who are deserving of equal rights and respect, as opposed to a burden upon their family and society. The results of these translate walks, in conjunction with in-depth interviews, provide a broader understanding of disability within the Vietnamese context and allow us to further consider the dimensions of access and whether access equals inclusiveness.
So the information gathered from transit walks and through qualitative methods of research have indicated important themes of consideration for all lived experience of people with disability in Vietnam. Community perceptions regarding people living with disability need to be founded on a basis of acceptance and respect. Rather than focusing on the physical or intellectual impairment, there should be an understanding and respect for the capacity to contribute to society as an equal member with dignity and rights. This can only be achieved through empowerment and equality in education, healthcare, and physical access, and informed community perceptions in order to increase social inclusion. Recent changes within disability services in Vietnam and legislation have indicated a shift towards greater appreciation of the position of people living with disability. However, there remains considerable challenges that must be overcome in order to increase quality of life. This evidence provides a basis for further research and service provision for people with disability in the future. Today we have briefly outlined these themes raised within the research. These themes include a number of sub-themes which we will be more than happy to expand upon if anyone has any questions. Thank you.
Yes, first of all, thank you very much. Very good presentation, a lot of information, and really telling the story. And I think this is also what our staff and also the students we should learn from them, because it's often we would like to do something big, we would like to have a big data set, we would like to have a lot of numbers, we would like to distribute a lot of questionnaire and have big samples, but at the end, it's often very hard to tell what kind of story we have. Or if you can see, this most of our reports just come up to different tables, and different figures, a lot of numbers, and telling nothing. So here is today, again, thank you very much. Very short time, 3 weeks, and you bring, you just give us, it's like, it's not really just some Irish, but it tells story, and even come up with some very impressive and also come up with inspired. I think it is, this is the one very good example where you consider about the resources. Resources here is about the time, about the experience, because you just from outside coming to this in a very short time to adapt to the environment. And now then how to explore in the very limited time of 3 weeks, and not all the time focus on this, also have other things to do. But now at least we come up with a very limited resource. So yes, it is not always to take a lot of resources, a lot of budget, a lot of human resources, big team, or to make a good study. So this is a very good example of research evaluation using a very limited resources. And also this is the replacement, the one objective of the replacement, where the student can apply different methodology. And here I think it's, I'm not sure how much you study at the school about repeated setting, but when you tell about that, you tell very confident about that. And yes, you know well, and for sure it is for qualitative research, you need more and more practice. Yeah, especially with the in-depth review of focus group discussion. Yeah, this is the way you apply here, especially the concept work. It's also very new for all people. You know, concept work. So basically, in qualitative research, we use three main techniques. One is the observation, but how you will observe it. So you can use it. Basically, you go to the field, you go to the place that you are going to explore. Maybe the first time with no structure, just go to observe anything, coming back with some notes, and then prepare for the next walk. The next time you come up and you verify more about what you, for example, last time you say you see is no ramps for the people living with disability, and you don't know why. So next time you will find someone to talk to ask, or to do more observation. So this is a very good technique, but we have never been learned at the school. So this is something new for you to learn about. It's also about in-depth review and focus group discussion. Many of us don't believe in the in-depth interview or focus group discussion because we think that it is only some pieces of information. It's not gathered it's not represent the community. But this is very useful if you apply it appropriately, especially in this case when you have very limited resources in time and human resources. I think it is another thing that we would like to ask you to share with us. I'm not sure if you're ready, but I found that to work together in a team is not easy. And I had experience being together with two other team members, also come from Australia. And we stayed together for 4 months, trying to finish the thesis. And a lot of discussion, and a lot of crying. It's good that we have one member in the team that he said that, okay, because at that time I and another member in the team often have a lot of human and a lot of discussion. And he said that, okay, you can argue that, but at the end of the day, at least you have something for me to write down here. So I will break your legs. So now I think this next one before Mr. Gopi can ask you questions. Please share with us what you learned. Saying together, well, let me just read a lot of things. So it's something.
I think we get lots of group work experience in Australia because 1 in 4 or maybe 1 in 3 of our assignments are in teams, and so that's very important in public health because you're going to be working with lots of people all through your career. But this was definitely a challenge living with those people. You have to stay civil for a whole bunch of the day.
I thought we all did well together. I think it happened that we were all studying a little bit different things. Some of us did laboratories, others did that. So we had different thinking. So it was nice to sort of put the diverse thinking together and come up with something really helpful in the Gravity report and bringing the ideas together.
And I think we were all conscious of drawing on each other's skills. So,
Yes.
for instance,
with the cultural exchange. That was all Kira. So things like that.
Yes, I think that is one very important is that we know other strengths and also weakness of the team member in the team, and then try to maximize this kind of strength member. Yeah, because it's quite new for student new and also even young staff. It's still very hard to work in the team. How to contribute, but also how to keep the for example, intellectual property. That is the idea of book. It's not just contribute a lot and then it will be taken by other people. So it's good that you already have worked together for a while and you know how to negotiate. And yeah, but I think it's staying together. It is also have to improve, especially in a new environment, where you have to again to negotiate with local partners and adapt to a new environment, and how to ask other people, because I think it is some of you maybe not easy to adapt, and somebody adapt well, and somebody adapt well, and even don't know why to adapt to the new environment because sometimes it's not worth to. Yeah, so.
Yeah, you write up the food. Yeah.
Firstly, I would like to say that I'm very liked your presentation, and it's a very good presentation as well as the story. But again, I'm concerned about how to work in the team. So maybe I will make a question related to the teamwork, because we have experience of 3 or more time work together. I found that working in a group is sometimes very difficult to stick everybody in the team to have the work done. So I just wonder, because in theory, we need a leader of the team. And I wonder who's the leader in your team and leader. Okay, so Daniel. And can you share any experience or any method that you have done to stick everybody and provide them with study like this?
You said crying. And days. I didn't realize.
I don't think she really expected to be the leader, but it came when we were just working together. She naturally took that role and helped guide us through. So.
Kept us on track like a mom. I think maybe we had a lot of discussions about what responsibilities were and making sure that everyone would either have a say in sharing out the workload, especially with the interviews. So I think making sure everyone was happy with the work that was being done and that everyone else, like they felt like everyone else was working as hard as them was a big thing to make it run smoothly. So I think usually a lot of problems in teamwork comes down to someone feeling like they're doing all the work and someone's doing nothing. So I think we were really conscious of avoiding that.
I think we all had something which we brought to the project. So everyone has different strengths, and Kira is our enthusiastic person. So she keeps everyone very happy. And Scott and Sky and Maya are very analytical. They look at data very well. And I have research assistant skills or experience, so I was able to use that.
Is that answer your question?
Yes. Thank you for your and I will read all the questions for all.
But at least you have some rules or regulations. Like, have to get up at 7.
None of us are very good at that. I think maybe unspoken rules. It is really effective to say what the rules are, but I think we found that we just did that naturally, expecting everyone to contribute, and we'd all joke for a little while, but as long as you went back to doing the work.
I think it was easier that we were all living together as well, because normally we're at university and you have to organise meetings and people don't come to the meetings, and that can be really difficult. But since we were all living together, it was easy to just say, we're having a meeting now, and get it done that way. But
Just keep knocking on the door until they get up.
And we were also able to maintain a balance. So we had work time and then we had social time and a bit of dinner time. We broke up as well.
Okay. Other questions? Are you getting up to speed?
Has said before about the Johnson work, and for me, and also for the last time, and one of the students here, it is you. Yeah. So can you tell us more about Johnson work?
it was a fairly new process for us as well, because we haven't really yeah, we haven't really done much work on them before in Australia, so this was a bit new to us. So we had to do a little bit of research about how to do it. There were a couple of different methods we could have used. There was the timing method, which we used, which we stopped every 10 minutes to assess the environment. There's also a distance method, and you stop every kilometre or every 100 metres or so to assess it. But we thought, seeing as we couldn't accurately measure the distances, this was the better method to use, the timing.
We also adapted that method. Some of the groups caused the parties in different places, so we felt that there was a place we should really analyse the data, such as a school or a hospital or a temple. We caused the clock and analysed that while we were doing the work. So we still got the data from inside places as well.
I think we found that after the first couple of walks, the system didn't work perfectly, so we made little modifications to it, and some of the criteria were difficult to measure, so we adjusted some of those to make it more suitable for the situation.
With the transit walk, what we had as well was a checklist that listed things like, is there a good footpath? Is the footpath clear? Is the road, does the road have a crossing? And so it went through down to are there lifts? Do the lifts have things? So it really listed out each thing that we were supposed to look for. And because of that, it meant that we opened our eyes to the things that are needed to make access easier for people with disabilities. And it's things that maybe you wouldn't consider just walking down the street, because we can walk down the street with a lot of ease. It's easier to think that the area is very accessible. But looking at it this way with the checklist, you realise that there are some physical barriers that can stop people without full mobility from actually going to certain places. It really puts in your mind what those places are important for, not only to just go and visit, but the social importance of certain places. So being able to go to temples like everyone else, and being able to go to the supermarket by yourself.
As I mentioned before, this is one kind of exercise using the observations. So it depends on the topic, and you can select different settings. Because here they concern about the access of the disability, for people living with disability. So it's often like you go to the street and you can observe it already. But if you think also more about people living with disability, you can go to where they stay at home and or in some center. So the settings depends on the topic, and it's often start with unstructured observation. So for example, you said that at the beginning it's quite hard or it is not going well. It's okay because it's just for exploration. It's better if it's better than you already have a checklist. And you think that in Mars, and then you go to the view, and then there are many things, but you just focus on the checklist. So it's having different steps, and the first step, maybe you just go there. For example, you go to the playground, or you go to the center, stay there for 2 hours, looking at the kids playing around, or how they act with each other, or how people act with each other. And you can find something that interesting, and you think that, okay, this should be explored more. So you write it down and you come back. For example, you think about the ramps. The ramps, it is where like the footpath or the way for the pathway for the people living with disability. So do you think that is a good thing to explore? So you go to different places after that. So here the group not limited to the street, but they went to the supermarket and to different places, public places. So many things to explore, but and you can repeat it, and together with our skill like key informant interviews here in that you can explore more, because for example you see that, but then you don't know why. Why is that? So you can ask some people that can provide you information. Yeah. So and it's very important that you will develop some checklists or some tools to apply. Because if you just go there and you spend several hours there, just observe and having taking notes, and you come back and you forget. But if you have some checklists, some other tool here, for example, they use a disability audit tool for accessible environment, developed by Professor and Julie King. So they based on something to keep their focus.
And also it meant that as we checked them off for all different places, we could bring all the information back and compare the different places and see what was common.
We also did a similar system to what you mentioned, and we took our quantitative data, and then we had another person in the group making remarks about the situation to sort of give light to the data and explain it.
For example, if you look at the people living with disability and you look at different risks for them, for example, the risk for falling. So if you go to the street, if you go to the supermarket, if you go to even to go to the house, and you often you see some stuff highlight this, it's very hard for them, and that is the one reason for them to fall. For example, we did it before in the study. We look at the children, the blind children, and it's not really totally blind, but with vision impairment. And the person who can see something are more often falling rather than people totally blind, because they can see something, so they often try to do it by themselves. So for example, if you look at they have one school go up to the Tambo Dale Street, and a group of blind children often go to school over there, and across the street and on the pavement often have some marketplace, and it's very often children, very often blind, and because of that the fact that they still see something, so they try to do. If they are totally blind, they will evaluate as an out. So that is one thing that you can even after this meeting, you can go to the park, go to the station, or you go to the street in the morning, and then you can see the how the people selling the food, how they practice. How about the sanitation, the hygiene and sanitation? How they clean the bowl before serving you, for example. Yeah, so you can do some very similar activities like this. But this is, I think, one new thing for you to learn about today. Yes, other thing?
First, thank you so much for presentation. And I so much your topic access to service for people living with disability. I think that's topic very interesting and very new. For me, that attracted me in the first time when you introduce your topic, and so many information you provide in this presentation, and some information I can understand, but I know with the limitation 3 weeks you go so many ways, so many hub center, just the Corona Program Association, and somewhere as a community health center. So I think your team worked very hard. Yeah, and could you tell me some difficult you have get during your research? And I see your objective is have 9 objectives, and I want to know how many objectives you gain after doing the research. And the last, could you tell me the interesting thing you recognize after this research? Thank you so much.
Three questions. First, the difficulties, what objective is he or
I think it was obviously difficult coming into a different country and a different culture, so that was challenging in different ways for all of us, I think. And it really helped having your guidance and the students' help as well. That made that a little bit easier. And obviously with the limited time frame as well, trying to fit in as much as we could, and trying to get a broad understanding of what was happening in a limited time was very difficult. But once again, the students were very helpful with us in that. Yeah, and the whole team.
Yes, another barrier for us was the language. We found the translators really, really helpful, but we also mentioned how the web questions are how to get the proper translation back on the basis of the language, because we weren't sure if it translated the same way that we were trying to say, if they understood the question the way that we understood it. But it's very different in terms of cultural context, and also how it translates to English to Vietnamese back to English. But we think we're really, really grateful for the translators who helped us with that. So it would have been impossible without you. That's just still a limitation for us because we're not sure how much data was lost in the translation process.
Limitation of the most of us had to do.
know everything about it in such a short time, but hopefully we've learned something. I think we have. It was really useful learning the qualitative skills. We've had a little bit of experience in Australia, but not a whole lot, so it was really good getting to practice that a bit more.
Just back on that first point, I think reading about it and witnessing it personally is completely different. And although we read about the situation before we came over to prepare ourselves, to see it in person is just something else, and you sort of appreciate the situation a lot more once you see it.
Just comment on that because here we can see some difficulties in access for the people who students, but it's also a very important topics or you have one time to explore is that they have limited access not only for physical access but also the limited access to other resources of society. For example, you can see most of the people living with disabilities are poor, but they also have limited access to different support programs. For example, the loans, because in different programs like that, people provide loans want to make sure that the fund is still maintained, or they can get something back after providing loans. So it's often the people living with disability are neglected or excluded. And now, so far some NGO in the country try to tackle this, the Buddhism, handicap protection, and they work in the micro level. So provide loans, but also to help them to how to access and how to work with local banks to borrow the money.
I think that was one of the themes that came up in the research is that poverty and living with disability there's a big relationship there. And of course they can't work with their disabilities and they can't solve poverty, so they can't access, you know what I mean.
That is much more important to them